I was one of 9 medical students based in Prince Philip Hospital in Llanelli, and we carried out the Ask One Question project there, and as well as that we also undertook some patient shadowing. This involved us, whenever a patient came into A&E, we would shadow their experience from their first interaction with a healthcare member or even with a receptionist, right through, including waiting with them in the room, asking them how they felt about each step of their journey throughout the hospital system, right until the end of their interaction with the healthcare team or the end of their treatment, whether that was ended up with them being admitted as an inpatient or discharge. So some of the medical students were based in a GP setting, but most of us were based within the hospital setting in Prince Philip Hospital. But we both asked the same question, and that question was, if there was one thing I could do to improve your day today, what would that be? So we again gauged the responses that we got from that and collated the data together. A lot of the patient responses were quite predictable, so things like waiting times. We all know that it's quite difficult to get appointments with your GP. You often wait a long time. I think whenever I shadowed a patient through their A&E experience, it was the first time I properly appreciated how waiting time really impacts your mood and which can impact your general well-being as well. So I think that was a useful experience for me to see. I found it actually quite surprising though how many patients talked about their interaction in terms of communication with members of the healthcare team. Particularly some patients highlighted that whenever the doctor comes round in the ward round in the morning, they don't introduce themselves, they just merely stand at the end of the bed and they just talk about the patient rather than to the patient. And I think if we put ourselves in the patient's shoes, that's not very nice. It doesn't make you feel included. So I think that communication was a key theme that kept coming up again and again. I think it's really, really important. I think it's important that we can see what the patients think makes their experience better, which overall helps their general happiness with the system. And I think that from what I've learned, I hopefully can take that forward into my own practice. I think before I did this project, I don't know if I would have considered it overall that important in terms of being a medical student, but having done it, I think it's actually been really, really useful, because at the end of the day, the quality improvement projects are carried out to help the patient. And whenever you help patients, you help yourself as well. And at the end of the day, the most important thing for us is the patient's best interests. So I think that quality improvement is really, really important. And I think it would be good if we were introduced to it a bit earlier in the curriculum.